give you an overview of the vertebral column and evolution of erect posture. I am standing here like this. That did not come in a day. Some millions of years with the evolution, we are at present at this stage. Fan chalabe. Now, you see this slide. What you are seeing? On Valentine's Day, when I was in Bhubaneswar, morning newspaper, on Valentine's Day, this picture was given. আমি ওটা রেখে দিলাম, then I inserted in this lecture. So, just to make you feel and understand, already you are understanding, you are feeling, যে কোন কম্পোনেন্টে তুমি চিন্তা করবে, how you will think, in what dimension you must think, because anatomy is a dead subject, anatomy is boring, but it is not so. So this is one couple. So it is taken from a newspaper. If it had been from downloaded from a good magazine or wherever that guy copied. But this is one thing I tell you, see the flexibility of the total human skeleton. This is what, but they are coordinated. এমনি করলাম তো মাথাটা এরকমই থেকে গেল. No, it's not like that. My cervical vertebra and this thing that is supported by all the ligaments and muscles. So this, and how caringly the gentleman is holding his girlfriend or might be wife, that feeling, you can see how she is caring. Now, this is one thing, এর মধ্যে তোমাকে বুঝতে হবে, you have to take the মজা. এটা পড়লাম, এটা স্কাল, একটা এটা ওটা, ঠিক আছে, আমি 10-15 মিনিট অনেক বাকওয়াস বকি, but you go home, think. In what level? Breast lectures, you will find it in any book. But I feel that this is a different component. And today you just go and read any book. Vishram Singh padke Vishram le lo. But these books are, but I would rather say that you don't hunt, search for multiple books. Don't make a crowd of any book, any subject. Never, never, never. Get your foundation strong, then you flip pages. When you go to surgery, you read Bailey and Love. It's a wonderful book in our days, but today's modern times, 2 volumes of Bailey and Love gives you the gateway to surgery. Now, with this little beginning, now evolution of erect posture. Now you can see brain size 380 to 450 cc, brain size 700 cc, and brain size 800 to 1300 cc, brain size 1 to 4000 cc. Now you can see this is Homo sapiens. This is what I am. Before my great-grandfathers or ancestors, I would say, not my grandfather, they were just like this. They used to walk like this, like a gorilla. And they, suppose you see the gorilla's hand, it is all thick, knuckles are thick because it knocks. So now this is the Australopithecus aliens, Homo habilis, Homo erectus, Homo sapiens. This is Homo sapiens, evolution of erect posture. Now you see an elephant, big elephant, a small elephant, a cow, or the quadruped animals. They usually don't have hernias, inguinal hernias or any hernias, umbilical hernias, or some hernia in this level, lumbar hernia. They don't have. Of course, there can be, but it's a remote chance that structurally the quadrupeds don't have hernias. But we, human beings, are having hernias, inguinal hernia, umbilical hernia, and your lumbar hernia, femoral hernia. Now, the difference is that with the evolution of erect posture, everything changes. So body mass, body muscles, and everything. Now, line of gravity through which the body, the line of gravity, Now, this is the line of gravity. Now, it is passing through the skull, the body axis. This is the sternum. This goes in front of the vertebral column and then just in front of the sacrum, and then goes behind the centers of the hip joint, then goes in front of the knee joint and in front of the ankle joint. Now the line of gravity is passing. That's why we are just walking like this. Okay. Then I want to jump. That gravity is moving like that. I want to dance. Now that line of gravity, the balance is kept. Of course, there are many components. Say the internal ear, as an organ, you get vertigo and this thing due to some diseases. That keeps your balance. And now the vertebral column keywords. What you have to see, the vertebral column keywords, parts of a typical vertebra and their function. You just know the typical vertebra. Then when you know the typical vertebra, then atypical. Okay. Now, body, ossification, processes, vertebral arch. The vertebral component has these 4 things. So each level, at the cervical level, at the thoracic level, at the lumbar level, at the sacral level, and coccyx. Now, you just imagine that the head, now your cervical vertebra supported by neck muscles, and the movement, this, and when you read the abdominal aorta, or you have read the brachial artery, this arterial supply, arterial network, the venous network, it goes in through direct in the arm, then goes into the forearm, then goes into your hands. Similarly, the cervical vertebra, it goes to the cervical vertebral foramen, the vessels goes and supplies the brain. So if the vessel has to pass through the vertebral, any part, that part of the vertebra, so there will be a, it's going. Now, parts of the vertebra from above, see vertebral arch, this spinous process, this is the articular process, this is the body, and this is transverse process. This is a main component of a parts of the vertebra from above. Now, the typical vertebra from side, the superior and inferior articular processes. This is the superior articular process, this is the inferior articular process. The facet for the rib, this is the demi-facets for rib. This is the body of the vertebra, inferior vertebral notch, this is a notch. Now, these things have some implication, and God or nature, whatever you believe in, has made in such a way that the spinal nerves, spinal cord, that is protected by the vertebral column. It passes. Now, that the nerves will have to come out to supply the muscles and your this is a book. If I were, this is out of print, I think. Kranz's textbook of anatomy. When in 1975 or 76, I purchased 35 rupees. But there are some, in many lectures I have incorporated these figures because it has a very lucid understanding. It's a fantastic book, fantastic book. Now, bony parts at birth. This is halves of the neural arch united to each other by hyaline cartilage. This. Now, centrum, neurocentral synchondrosis. Now, composition of intervertebral foramen. This is the two vertebrae. চক্করি ওহো, এটা কি তোরা ফিক্স করে দিয়েছিস এখানে ওটা? হ্যাঁ, তাহলে ওই সবুজ বোর্ডটাকে ওইখানে লাগিয়ে দিবি। ঠিক আছে, ঠিক আছে। Now see, what I want to say is that now this is one vertebra, this is the body. Now this is the nerve coming out, and see, this is the articular processes. These two surfaces of uniting, you see in the skeleton. Skeleton ta ajke dekha jabe. Now you can see, and this is the disc, intervertebral disc. In between the two vertebra, the disc is there. It's a cushion. এই যে একবারে এমনি করে তোমার ডিগ্রি পাওয়ার পর হ্যাট ছুড়ে দেবে, হায় করে একটা ছবি তুলবে, হ্যাঁ, তো but you fall, someone falls like this, but some person they fall, they just jump in long jump, and gymnastics, the vertebral cushion is a buffer. Now you will be, it's a common thing, your motorbike, your cars, and our sedentary habits, that mechanism gets sometimes problematic. There might be a force that in between the disc, there's a You will meet with an accident, we fall, and then that imbalance causes some rupture of the whatever that protrudes. Now, if this portion goes inside, then the nerve, the spinal nerves are this prolapse. So you, for all this prolapse or PID, prolapse intervertebral disc, you need not go for surgery. You, because of today's investigations, physiotherapy and this thing, MRI, CT scan, anything. But MRI sometimes exaggerate images. So see how much in neurological examination, your clinical examination, if there is any loss. If you are, then there is even nerve conduction velocity test. You can, for each limb, you can measure how much is there. Rest, physiotherapy, short-wave diathermy, if there is no fracture element. So you can diagnose and then do. But when you need, there's a fracture or something like that, then you have to go for spinal surgery. That's a different component. Now, you know the basics. Now see, the proportion of bone and disc in presacral parts of vertebral column by use of TOTS data. These are data. Now, what I want to focus is this. See, cervical, the bone is 9.6, disc is 26.9. Now, this is thoracic vertebra, 48.4. Now, 116.7, 63, total 432.7, 139. Now, thickness in millimeter. Now, what I want to say is this is the cervical, this is the thoracic up 12, and this is the lumbar 5, and this is the sacrum. According to the body of the vertebra from above, it goes in expanding. You see here. So you can see now development of curvatures of the spine. Now this is the midterm. Fetus, this is at birth, it is like this, and adult it is like this. This curvature is there. That's why when immediately a baby is born, that's why the mother or he or she, the father or the surgeon taking out. Of course, it depends on what position, cephalic presentation or something. Then if it's cephalic, gently we hold the neck and the head of the baby and then take it out. And now with development, at birth it is like this. Adult, and this is at birth. Slowly, I have my youngest daughter's, she gave birth to a girl child. Initially, her head was like this, like this. But as she's growing now actually I have done numerous cesareans and normal delivery births. That girl I delivered 25, 30 years ago, that was a girl child. Again, now that girl child has got married and she comes to me for a antenatal care. So 3 generations. Now, one thing is that I'm saying this curvature, no? This head. তারপরে এখন একটু এরকম করে তাকাচ্ছে, I'm singing, then she's like this. See, the baby, she's so cautious. তো ঝাট করে তুমি একটা আওয়াজ দেবে, এমনি করে ঘুরবে না কিন্তু। The nature is protecting. The muscles are protecting. The reflexes are protecting. Now, I see the adult, Netaji Subhash Chandra Bose, একদম এরকম করে চলবে, ঠিক আছে? I'm just saying that chin high, head high. Now, these are the homologous part of cervical thoracic lumbar. Now, you see vertebral foramen of T6 not larger than finger ring. Okay. Now, this is the T6. তো আমি ধরো এই মালাটা তোমার আছে, এগুলোকে মালা বলি। Okay. Now, cervical vertebra. Now, this is the, see the body size. Slowly. Okay. Now, what I want to stress is that ধরো 4-5টা vertebra, thoracic vertebra রেখে দিয়েছি, যেমন 6 vertebra তোলো, তো তুমি আঙুল ধরে দেখে নেবে ring finger. It does not pass through like you put in lumbar vertebra, it will go through. ঠিক আছে? This is one thing. দুটো মালা আছে, কেউ কাউকে পড়িয়ে দিও না, কিন্তু you just see the things, the arrangement that is there. You see the skeleton and you see the ribs. See how it is attached to the, I showed you the previous picture, the facets for the rib. So please note that. See, তোমার দুটো পার্ট, যখন তুমি একটা thoracic vertebra ধরবে তখন তার facet, facet থাকবে, facet for the rib. তোমার নেক্সট ক্লাস আছে intercostal vessels and nerves. You see today, please see, don't hurry to the hostel, see it how it is attached. মানে thoracic vertebra সঙ্গে lumbar vertebra component বোকার মতো, মানে সেকেন্ড যে সাপ্লিমেন্টারি এক্সামে তোমার দাদা দিদি যারাই থাকুক, একটা লিভার কি সেটা বলতে পারছে না, আমরা ধরেই নিচ্ছি, we have taken for granted 20 থেকে 25-30টা ফেল করছে। Why? Because you are taking your life as a casual. আর হবে না, তুমি দিয়েছো, পরীক্ষা দিয়েছো তোমরা, একটা হলো তো বোধহয় টেস্ট সুব্রময়ের, একটা কার খাতা, এই খাতাটা কার রে, নামটা, ওখানে একটা খাতা পেস্ট করা আছে। You will fall in love with that guy. If not that guy, you will fall in love with seeing the writing. It is your friend. So please, যা বলছি শোনো, মন দিয়ে শোনো, কিন্তু don't take granted, কারণ your examination will be total surveillance. Camera, অমুক, হ্যান ত্যান, you can't imagine. বেশ কিছুই থাকলো না, আমাদের সময় কিছুই ছিল না, no camera, nothing. But we did it. but we never used to bunk anatomy, physiology, মানে physiology পরীক্ষা আছে বলে অ্যানাটমিটা বাঙ্ক করছো কি করে? Don't. So, you read anatomy in groups when you are discussing, like you vertebra, তোমার বোন সেট নিয়ে 10টার পরে ডিনার করে নেবে, দিয়ে তখন তো ঘুম আসবে, দিয়ে ওই বোনস গুলো দেখবে, অ্যাটলাস দেখবে, না তোর হচ্ছে না, রাইট, ধরো ধরো হিউমারাসটা ধরো, ধর এটা ধর, you have to, your school days are gone. So similarly, vertebra যার আছে তার মালা করে দাও একটা সুতো দড়ি দিয়ে, যে রুমমেটের আছে সেটাকে নিয়ে তোমরা দেখো, at least you have to identify ট্রে থেকে বলুন pick up the lumbar vertebra. তুমি শুধু সার্ভাইকেল পড়ে এসছো, how can it be? गर्दन इतना तक पड़ा, इतना तक नहीं पड़ा, अरे भाई body that the body thickness body of the vertebra that identifies. এবার intricate structure ওই ফুটো দিয়ে ওই যাচ্ছে এই যাচ্ছে, আরে ভাই আইডেন্টিফাই তো করো পহলে, you will get marks because exams we are in a hurry, even everything should be done in time. So what I want to say, your identification carries the marks, and then you say, then you describe the body, then you describe the processes, then what it articulates with the fifth lumbar vertebra articulates with what. এই যে ধরো this pelvis, these are two hip bones, it is articulated. Now this is the sacrum and this is the hip bone. I am asking, what joint, what bones comprise the sacroiliac joint? বসে আছে, না, why you give up? कुछ तो बोलो. Hip bone, it has a sacroiliac, sacrum with ilium, bas. Now, see, previously I told you the compression of spinal nerves. Here, this is the spine, this is the cerebellum, these are MRI, and you can see how it is compressed, kinking over here. Now, laminectomy in spinal stenosis. The spinal stenosis is here. This is spine, and this is spine, this is the spine, and this is the lumbar puncture or spinal tap. Lumbar puncture or spinal tap. It's a very common procedure. Now, if a patient with high pyrexia, signs of meningitis, encephalitis, anything, infection of the meninges of the brain, then there's some presentation of encephalitis, then you have to send do a spinal tap and send that fluid for biochemical, microscopical examination. Yeah, what type of disease and how severe it is. So you must know your anatomy, and this is a common procedure. Now this is the epidural anesthesia. Again, now this is coccydyna. Some persons they complain that sir, এখানে একটা আমার এখানে কিরকম সবসময় ব্যথা হচ্ছে, চেয়ারে বসতে হচ্ছিল, মোটর বাইক চালাতে যাচ্ছি তখনও ব্যথা হচ্ছে, হ্যাঁ, then you have to palliative means you have to do some analgesic drugs and other medicines, and you give nowadays cushions are available for especially coccydyna. in your any surgical goods store. You can, and you prescribe, see, I told you in that class, breast class, this thing, you just had a medicine likhe dao, that's not your only duty or prime duty. It is not that. But you have to guide. The person has come to you, you have to tell, prescribe, and not that একবারে সে প্রিন্ট করে নিলে পুরো আসছে একটা সার্টেন মাসল স্প্যাজম প্রবলেম নিয়ে, একটা ব্রেস্টের প্রবলেম নিয়ে, সেটা তো এলএফটি, অমুক সিআরপি প্রোটিন, অমুক সুগার, হ্যান ত্যান, যেগুলো দরকার, what you need, you have to do that. Okay. Another thing is that now see cervical spine embolization. This is a common now in RTA, road traffic accident. They see the steel plate, here the screw, here the screw, there is a wire there, and this is the skull. There's some fracture is here. Now, caudal anesthesia, vertebral venous plexus, batten valvulus plexus, that I showed you in the venous drainage of the breast, the vertebral plexus, venous plexus. This is a fracture vertebral body. This is the vertebral body is fracture. This is the fracture vertebral body. And see spondylolisthesis, L5. Yeah. You can see the vertebral, see. Vertebral bodies, the radiograph. Spinal diaphragm, chorda equina, and sinus. Scoliosis. This is you can see people, it can be congenital or it can be your any pathological. Most common is that tuberculosis spine, tuberculosis of spine in our country. But then too, with awareness, it is decreasing, and beautiful drugs are there. And now this scoliosis is, you see, men are going like that, or a big hump like this. Naturally, you once that enters, but he's come for your medical treatment, pyrexia, not the spine problem. He's not going to complain about the spine problem. ডাক্তারবাবু জ্বর হয়েছে, আমার খুব ব্যথা হচ্ছে এসব, but when you examine that patient, you put a note scoliosis, and you examine the spine একটু দবাকে, it's any examination of the spine. See, it is like this. You see, বললো আমার ঘাড় ব্যথা হচ্ছে, হ্যাঁ, then you tell, দেখি, you put a palm like this, nama, then you give a counter force. You will say, ah. If he says, ah, don't force. ওইদিকে ঘোরা. Again, okay. আবার এদিকে, ঠিক আছে, পরে পেছন দিকে, না পেছন দিকে, না দে. Now, this is one thing. Examination হলো, হ্যাঁ, দাঁড়া আরেকবার দাঁড়া, ধরো ও তো ওর স্পাইন, হ্যাঁ, সিট দ্বারা সোজা, মানে he has an erect spine, Homo sapiens. So, but say he has some problem, he comes with a pain, or একটা bucket ওয়াটার নিতে গিয়ে লিফট আপ করতে গিয়ে এইখানে দেখবে when you feel like this, I'm not opening his shirt, okay, এখানে যখন ফিল করবে এরকম করে জাস্ট লাইক দিস, লাইক দিস, এইখানে ও দেখিয়েছে, তখন তুমি এরকম করে দিলে, তো একটু এরকম করে দেখে দিলে, আবার যখন এই ঘাড়ের যে ইয়ে করছিলাম, that means if she is having some fracture or some spasm, due to that jolt, ছাগল চলে এসছে মুলুকের মোড়ে, তো তোমার মাথাটা এরকম হয়ে গেল, এরকম হয়ে গেল, তুমি তখন টের পেলে না, তখন চলে ক্লাব সেন্ট্রাল, ওখানে একটু পার্টি ফার্টি করলে, যাই খেলে ওখানে দারু আলাদা জায়গায় বিক্রি হয়, তো এবার ফিরলে হোস্টেলে, পরের দিন তুমি আর ঘাড় নাড়াতে পারছো না। ডোন্ট নেগলেক্ট, ইউ গো শো ইয়ার ভোরবেলায় তুমি একটা অ্যানালিসিস খেলে যা খেলে, গো অ্যান্ড হ্যাভ আ রেডিওগ্রাফ ডান, ঠিক আছে? এবার কথা হচ্ছে scoliosis. Now, congenital spinal malformation. This is the vertebral column. When it is developing, there are, or the whole embryological part, which Professor Avijit sir is started already. ওটা এমব্রিওলজি 2 নম্বর আছে, 5 নম্বর আছে, দ্যাটস অল রাইট, বাট ইউ যেটা এক্সামিনেশন, ইউ হ্যাভ টু বি ভেরি ফোকাস নাও, ওয়ান পার্ট ইজ কমপ্লিট, ফোকাস ইন দি সেন্স পরীক্ষায় নম্বর পেতে হবে, মুখে বলতে হবে, লিখবে লিখবে যত পারবে লিখবে, আর রাত্রে 12টার পরে আর ঘুমিয়ে যাও। You have to alter your biological clock. Last 3 years, 4 years, NEET PG, অমুক PG, এই সেন্টার, ওই সেন্টার, ফিজিক্সওয়ালা, রাত 2টোর সময় তুই সন্ধ্যেবেলায় অ্যাটেন্ড করতে পারোনি, সেই লেকচার নোট অনলাইনে, তারপরে এই পড়ার পর অনলাইনে তুমি যাচ্ছ, ডোন্ট, ইউ নিড নট গো। এই আমরাই যদি অনলাইনে একটা, আমি যদি প্ল্যাটফর্ম করি, সুব্রময় স্যার আমার নিজেরা একটা প্ল্যাটফর্ম করে, কিন্তু ব্যবসায়টা তো বুঝিনি, না ডাক্তারিতে না কিছুতে, না না রিয়েলি আমি এটা কাজ করছি, আমি তখন মানে কত টাকা নিতে হবে এটা আমি মানে আই ক্যানট ডিসাইড। তোমাদের যা আছে, যা পড়ছো সেটা পড়ো, আর এখানে ভার্টিব্রা দেখে নেবে, আছে আমাদের প্লাস্টিক আছে, যা আছে ছবি আছে, সেটা দেখে নেবে। আর খিদে পেলে এখন ড্রাই ফ্রুটস অ্যামাজন থেকে আনিয়ে নাও, নানান রকম ইয়েতে চলে যাও, টুকটাক ড্রাই ফ্রুটস, তাহলে তোমার স্কিন ঠিক থাকবে, ঠিক থাকবে, পেট ভর্তি থাকবে। এটা একটা বললাম। এইটা বলছিলাম, আমি পরে একটা গ্যালারি করার প্রোগ্রাম চলছে, তো I have one of the rarest, these congenital malformations. It fascinated me very much. So I have written a small monograph in 1988 in Delhi's first Asia Pacific conference. And then by the time from 1988 means my school student age, I used to collect these delivery fetus in my hospital or some other hospital, and I took it to my Bardhaman Medical College. There are some rare specimens, and I photographed most of them. Now, this is a component that it does not, the spine, there is spina bifida, there is some defect on the arch. Naturally, the contents of the spinal cord and this thing with meninges, it comes out. So this is one of the pictures I'm showing you. Next, I will, when you start hematology, next just at a casual গল্প ছলে আমি তোমাদের দেখিয়ে দেবো। Yes, just slide show. কারণ একটা ইমেজেরি তৈরি হলে, because nowadays you will rarely see these defects because of ultrasound. And it is your duty when you become a doctor or a physician, a lady, you are an MBBS. I told you a good MBBS is a good postgraduate. You are sitting in a chamber or you are sitting in a hospital, government hospital, municipal corporation hospital, you getting 20,000 pay. One lady comes, Doctor, I'm pregnant. Now this, আমি বেঙ্গলের কথা বলছি, অ্যাকচুয়ালি আমার ভালো লাগার জায়গাটা কোথায়, একটা কাউকে ধরো আমার গ্রামের পেশেন্ট, আমি যখন তাকে দেখছি তখন বলছে তোমার কি প্রবলেম, না আমার কোনো প্রবলেম নেই কিন্তু আমার এই জায়গাটা প্রবলেম হচ্ছে। এই যে প্রবলেম ওয়ার্ডটা ইউজ করছে, এটা কিন্তু আমার ভালো লাগার বিষয়। সিমিলারলি তুমি বলবে যে তুমি বাবু একটা ধরো 2 months তোমার কাছে এসছে, বা she comes and says there's a spotting. আজকে হঠাৎ করে বাথরুমে গেলাম, দেখলাম যে আমার 2 মাস মেন্স বন্ধ ছিল, হ্যাঁ আমার একটা স্পটিং হয়ে গেছে। স্পটিংটা বলছে না যে কিরকম যেন মাছ ধোয়া জলের মতো, মানে when you cut a fish, then you water clean before cooking, then as more water is, it is red there, but when you pour water and clean before cooking, it becomes diluted and that color becomes more dilute. So patient will complain that এটা মাছ ধোয়া জলের মতো আসছে, or in your any Hindi belt, they'll tell you in Hindi. So if you are তোমার, she comes with a plastic, Karina Kapoor, okay, she puts it there, ডাক্তারবাবু আমার দুটো দাগ এসছে। So দুটো দাগ means the urine she tested, she's pregnant. Now you handle accordingly, you tell okay বাবা রেস্ট নেবে এ নেবে, কালকে একটা ছবি করবে, you do a USG, then there is no such this thing, then you repeat USG at 12th week. But in 8 weeks you see the cardiac pulsation, the small embryo, it is there. But if 12 weeks, it is more mature and it will give a report of living fetus. Now from that first ultrasound, a second ultrasound, now in between 19 to 22 weeks, 18 to 22 weeks, you have to go for an NT scan and also your anomaly scan. Now you can see in anomaly scan, you can see the position of the skull bone. You can see if she is having a cleft lip, if she is having a cleft palate, if she is having deformity of the limbs, if she is having a short limb, or she is having no limb, left upper limb is missing, amelia, and right limb is okay. It is your moral and social duty to avoid the patient that you get it terminated. if you find a report with some ventricular, when you read brain, the ventricles are there, right ventricle, left ventricle. Now, if there is some defect, if sometimes sonologist is in a hurry and he gives a report, heart এর একটা কিছু problem বললো. If he's in a hurry or he is correctly reporting, I mean, I'm not biased. I'm saying then it is your moral duty to say that you get a the cardiac echocardiography or neonatal, মানে pre-birth হচ্ছে এগুলো. So much thing is that the tool is there, so you have to differentiate. Now at this age, if a person delivers with the spinal defect, with a big this state of affairs, because surgery, there are many people, many centers throughout the world, they have done surgeries, but it is not, the results are not good. And we at present in India have not seen any hospital as such, big, যাদের বলা হয় বড় হাসপাতাল, but there is some center with a pediatric surgeon who's done that. They do it, they try it, but at this stage, no such birth should be, means there should be no birth of such defects, hydrocephalus. So this is one thing. This is a spinal and the thoracic, I mean the total can be any deformity there, but usually it is between this part. Okay. Now this is the injuries of the mechanism. I'll just go through. Now this is crash injury, the fall mechanism, how it falls, and you get a break, see, in the vertebral bodies. চুরমার হয়ে গেছে. Okay, now this is the flexion injury. এমনি করে দুম পটাশ ঠাক করে লেগে গেল, ঠিক আছে. Now you see the state of affairs in this. Extension injury, a car, long drive from second bridge, Howrah, to nearest Digha. Okay, be careful, you're going on a long drive in a motorbike or anything. Helmet porbe, shopping porbe, or you can see how this is separated. See, সিট বেল্টটা আছে তো ধাক্কা লাগলো, দেখো কিরকম ফ্র্যাকচার হচ্ছে, দেখো. You fasten your seat belt, definitely.